I'm Maureen Connolly, the editor-in-chief of everydayhealth.com and the host of Boxed In, a health series from Everyday Health featuring conversations with the country's top mental health experts on the COVID-19 pandemic and its impact on our mental health and well-being. My guest today is Dr. April Naturale. She's a traumatic stress specialist with 30 years of experience as a mental health care administrator and a clinician specializing in response to traumatic events. After 9/11, Dr. Naturale directed the New York State response to the World Trade Center disaster. She's often called in to counsel victims of mass violence, including the Las Vegas shooting, the country's deadliest mass shooting. A little later in this conversation, we'll hear from George Contreras. He's an assistant director of the Center for Disaster Medicine and assistant professor at New York Medical College. In addition, he's also a New York City paramedic who has been working in the New York City EMS healthcare for 30 years. He was one of the first responders in the Twin Towers after 9/11 and has been on the front lines of the COVID-19 pandemic. But first, Dr. Naturale, thank you for being here.
Thanks for the invitation, Maureen. I appreciate the opportunity.
So you've been on the front lines in the aftermath of so many traumatic events, from 9/11 to the Las Vegas shooting. And now with the COVID-19 pandemic, what are some of the threads you see in terms of how people react immediately to trauma and then the long-term effect?
Yeah, it's a good question, actually. We don't have a whole lot of research on long-term effects of these events, but we do know that because this is a prolonged event, we don't have a chance to settle down and figure out, what's going on and what we need to do. We remain at this heightened sense of having the threat of severe illness or death to ourselves or loved ones. And so looking at the long-term effects are going to be, we know that they will be emotional, mental health effects as people deal with this incredibly frightening and invisible type of threat to their life. What have we done in the past when we've seen some of the long-term effects? Most of the research which has actually come out of studying some of the 9/11 victims, responders, and family members. And we know that things change over time too. In the immediate, we see sleeplessness and stomach aches and headaches and anxiety-like symptoms. And later on, we see more personality and social type issues such as domestic violence or substance abuse. So we're having to keep ourselves really abreast of what are the changes in symptoms and the severity of them so we can figure out how to help people in the long run.
Right. And I imagine, there are, different experiences, obviously, for people dealing with this, meaning, the people like myself, for the time being, who feels, I'm home, my kids are home with me, we're healthy, right? And yet there's this whole world outside happening where people are dying day after day. There are healthcare workers on the front lines putting their own lives at risk. And then there are people seeing the people that they love get sick, right? And having to care for them or to bury them. And I just wonder, in terms of like trauma as a response to something like this, let's just start with the people who are not in the eye of the storm. How does trauma impact them?
Well, it's a little bit of a complicated question. So let me start by saying it's actually exposure to the threat or the fear of the threat that can affect anyone. So what we learned actually as far back as 9/11 is that even watching a traumatic event on television or seeing pictures of it in the news can cause distress, especially to some high-risk groups like, say, children who might not understand what they're seeing. They aren't at the developmental level where they can figure it out. So, for example, there were lots of calls from parents during 9/11 saying their children kept thinking that the attack kept happening because they kept seeing it over and over again on television. And then we have the concern about people who've had previous traumas. And seeing this new event, seeing the numbers of deaths and the constant news about more people getting sick and the prolonged need for isolation. If somebody's had previous traumas, that might listening to the news now might activate some of the symptoms that they had in a previous trauma. And there may be others, again, who are closer to healthcare workers like George. And so, of course, they're going to have a heightened concern because somebody that they love may in fact be at more risk than others who are at home. But again, those of us who are safe at home, listening to the news and watching this on TV and knowing that just going out to the grocery store could bring serious illness or death is going to bring on some distress responses in anyone.
Yeah, and it's interesting that you should say that, because this idea that something as simple as going to the grocery store, right? But the mindset that you're in there going, okay, I need to go get food for myself and for my family, and yet by virtue of being here, I could, get a deadly virus. And then we come home and sort of go about our day. But I guess what I'd want to know from you is like, how can someone, like, how do you process that? Is there anything you can do, or it's just sort of the reality that we're living in?
Well, I think to a certain extent we'll get a little bit adjusted to it, but certainly following the rules about the protective measures can be very helpful. And what your perception of protective measures for you might be different for me. So for example, I started wearing a mask back in February because that made me feel better. And, recognizing that there were high flu symptoms in a lot of people at the time. And so even though the recommendation wasn't up there yet, it made me feel comfortable because I'm hyper aware of these things. I've seen other people, though, go into the grocery store not wearing masks or wearing gloves. So some of it has to do with our own perception of what makes us feel better. And I highly recommend that if there are protective measures that you want to take, whether you go shopping at early in the morning because there are less people there, or you double your mask, you use one of the cloth masks in addition to a paper mask, and gloves. It's all about perception. If I think that I'm doing things to protect myself, it's going to decrease my anxiety. So that's a helpful thing to do. Any way we can figure out how we might get a little bit of control of this can decrease our anxiety. Our problem with this event, though, is that the threat continues. And so not having a break from it, keeping us at a very high level of anxiety all the time, does make it much more difficult. So it's really important for us all to talk about this and to figure out what it is that might help us, because it looks like we've got a continuous stretch of being at a heightened level of anxiety and fear. We need to do whatever we can to make ourselves feel better. A lot of that is to practice de-stressing types of exercises, whether it's deep breathing, meditation, moving your body so that you get stress hormones out of your body, and even simple exercise like walking, jumping, yoga, things that will help move toxic stress hormones out of the body, because they will flow continuously when you're under a constant threat.
It's so interesting. It's so many of the simple things that experts like yourself are recommending in every interview that I do. It's, prioritize sleep when if you can, right? Get sleep, at least try to go to bed at the same time. Make sure you move your body, choose, good foods, right? Don't, abuse
Absolutely.
alcohol. But when it comes
up your routines, because we're creatures of habit. We like our routines. And so there's enough upheaval and change. So I think you're right. If you've heard people saying that trying to keep up doing the things that used to do before can really make our bodies feel better. Our minds remember things and our body cells remember things. So if we're doing things we usually do, you might, be thinking you're nervous, but your body says, oh, I remember this. Okay, this is comfortable and familiar, and it can actually decrease anxiety.
Okay. Yeah, and when it comes to children, so I guess of all ages, because all age children are back at home with a lot of parents, 20-somethings, teens, and younger kids. And I have 3 children, and they seem okay. They're off in their rooms, doing their schoolwork and video games. But I spoke to somebody who said, don't, and it was another mental health expert who was saying, just because they're not communicating their fears or talking about them openly doesn't mean that they're not worried about this. And so don't take that as just a sign that everything's okay. So I wonder, what would be your advice to parents to how to watch for signs, but also to help a child to process what's going on?
So there are a couple of rules, because distress affects children differently. And obviously you have 3 at different developmental age levels. They're going to understand and process things differently. So we know that in younger children, like say the 5-6-year-olds and under, they don't really perceive what's going on in the outside world or understand it as well. So they're just going to mirror your reactions. So if your kids are hanging out and seemingly comfortable, obviously you're doing a good job of helping them to feel safe. They need to know that the adults around them are in charge and are going to do the best to take care of them. When you start to get to the kids who are, tweens and teens, they're going to be accessing a lot of information and trying to process it. So one of the things we recommend is to have the discussions. I think you got good advice, not to ignore the fact that just because they're not talking doesn't mean they don't have concerns. So I think it's worthwhile to have a conversation and ask them what they know and what they understand about it, because you want to correct any misinformation or myths. And again, you want to give them the sense that the adults, the carers in their lives are in charge and in control. And then you want to talk about, what things that they can do to help themselves feel better. Doing their routines, participating in the family, continuing to reach out on social media or on the phone or however they're connecting with their friends, and doing the things that they would normally do. Homework is important. If they've had chores in the house, they need to get back to continuing to do their chores, because again, our routines really help us to feel better. But you do want to make sure you have the conversation so you understand, what they're hearing, and you can talk about what they understand and correct any misinformation. I have to say too, is you don't want to overload them with information either. We tend to try and explain things away and maybe give them too much information when they might be asking you what's going on today, and you give them all the news, and really all they wanted to know is what time they were going to have dinner. So we try to keep it simple and not overload them.
And what about the millions of Americans who are out of work and this, sense of unbelievable financial burden now, not knowing they're going to be able to provide for their families, and here they are trying to, take care of the kids still at home and do what they can to get by day, but how would you describe what's happening to them in terms of trauma?
It's probably one of the biggest issues that we're concerned about, Maureen, because there are several reasons. On a psychological level, work is really important to us. We need to have a sense that we're part of a community and we're participating in that community. And again, of course, that we can provide services for our family, the basics, food, shelter, and meaning. These are some of the three basics that human beings have. And so I think that what to say really at this point is that people should access whatever services are out there and available, that there shouldn't be any shame in accepting the food donations from the food bank or help from a family member or a colleague who's able to do something. Because again, at this time, everybody needs to feel like they have a role in helping each other, kind of like the old barn raisings that used to happen. We know that it's local community that takes care of each other. Certainly there are folks in the government and the state and the feds who will be doing things that can help us as we move along in this. But the truth is that the people we get the best support from and the people who make us feel more secure than anybody else are the people in our immediate social circle. And so we do really recommend that people allow each other to help each other, give them an opportunity to do something for you, because there's probably something that you might be able to do for them at another time or something different during this event that might be helpful to them. So it really is communities, our social support that really helps us to get through these things. We should allow it and offer what support we can, because again, we can do all kinds of mental health therapy with people, but the research is pretty clear on this, that social supports help more than anything else.
So you work with a lot of healthcare providers, and George is going to join us shortly. But tell us, how is the pandemic impacting them? I mean, this is huge.
It is huge, and it's been interesting to see what's happening with the healthcare workers. Obviously, they're the ones who are on the front lines, and their lives are threatened more than most people's at this time. And again, I've worked with healthcare workers for the longest time, and I'll tell you, they've got more grit than anybody I've ever met before. The doctors are working long hours and making themselves available and doing whatever needs to be done. Nurses are doing double, triple shifts. These are things that they've always done. They always show up. They always do whatever is needed. And actually, that's not changed. We haven't heard on social media or on the TV people who've been interviewed saying, I'm not going to work, I'm not doing this anymore. We actually usually see and hear the opposite. They're always jumping in to help their colleagues, their patients, doing double shifts, doing whatever they need to do. The truth is that I think it's the rest of us who have failed them, because I think what's really getting them upset at this time is not having the protective equipment that they need in order to do their job. Because I think that it would help them tremendously if they knew that they had the support of all the rest of the country saying, we need to make sure that you have what you need to protect yourself and do your job. So the sooner we can make sure that they have as much personal protective equipment as they need as possible, I think we'll see them do a little bit better in terms of their emotional status. In a sense, we've failed them, which again, preparedness issues are pretty complicated, because hospitals do prepare for these incidents, clinics do prepare, but we probably don't do it as much as we should, and then follow on with getting all the supplies and the equipment. We need to do a better job with preparedness. But in the meantime, I think that the discussions and the social media support that nurses and doctors and EMTs and all the folks who are in the huge healthcare industry, whatever kind of support we could give them, we should be able to do so. First of all, making sure that they have what they need to do to continue doing their job, because they're going to stay at it. They're one of the hardiest groups, and they really are extraordinary people, and we need them right now. So anything that we can do to support them, we should.
Well, speaking of extraordinary people, I'd like to have George join us now.
Hello.
Hi. So you had a piece published just today in the Daily News. And before I guess you get into that, you've been on the front lines of this pandemic since it started. What is it like for you day after day being out there, and how are you holding up?
Well, it certainly has been challenging. One of the concerns for many of the EMTs and paramedics, and I know as well as doctors and nurses and other healthcare providers, is that, because this is a biological agent, and there's the issue of the fact that it's so new, being a novel disease, and that it is infectious, highly infectious. And, for biological agents, we are concerned about incubation periods, with the issue also that people are and can be asymptomatic. The person next to you, walking down the street or working next to you, could be infected and just not know it. And if appropriate precautions are not taken, you're putting yourself at risk of also getting infected. Like Dr. Naturale said, they're not really concerned about going to work. They have that deep-seated dedication of going to work, but they are concerned about what's going to happen when they go home, which is why we've seen reports of many people, healthcare workers, not going home, not returning home, and sleeping in hotels or in cars at the beginning because they didn't want to take the chance of exposing people at home, which may have underlying conditions, and they might be even more vulnerable than the general population.
And then the other side of this is, if you're able to do what you're supposed to do, which is to your point, like if you're asymptomatic, don't assume that you're fine, right? You could be out there and infect someone else. So this idea that, do what you're supposed to do and shelter in place and try to avoid contact with people. And it's going to be even harder as we move into spring and summer, right? Or summer.
The whole point of staying at home and keeping people inside has really been to help the healthcare system, flattening the curve is the term you've been hearing out there. But the whole point of that is to reduce or expand out the number of people who are infected over a period of time so that the healthcare system themselves does not become overwhelmed. And I think we've done a good job of doing that. My concern is these past few days, the weather has been nice, and you can definitely see the difference of more people going out to the streets, more people congregating in parks without masks. And I think this is going to have a pretty dire consequence that we'll see in the next 2 to 3 weeks, when cases, I think, will start to go up again because people just becoming a little bit more complacent. And as you mentioned, as the warmer months come upon us, more people are going to want outside. I understand it's pretty frustrating to be inside for an extended period of time. In a city like New York City, which is so densely populated, it's really hard when you think about that physical distancing that people are talking about,
And talk to us about the opinion piece that you wrote.
I wrote that piece, and because my concern, from the EMTs and paramedics that are out there working day in and day out. They certainly have gone through some very challenging times this past month or 5 weeks or so. Records were broken in terms of call volume in New York City. We surpassed 7,000 calls, which is unheard of. And so if you walk around or drive around New York City, you may notice there are quite a number of ambulances with out-of-state plates. And they're actually here helping the EMS system because of the call volume. And so what I wanted to address in that piece was really because of what happened in the last few weeks and the number of calls and the number of critical calls really that we have had to deal with. And as we all saw in the statistics, the number of people who died on a daily basis was really pretty daunting. It was really hard to go on these calls and end up the persons that we were taking care of dying. And because of the current changes in protocols and the pandemic that we're going through, we would have to leave them at home. Having to deal with death on such a high frequency, even during one shift, I think was I've never had to do that in my career. I've had some challenging experiences of people dying in the ambulance and allowing people to say their final goodbyes because we would have to take them straight to the morgue as opposed to the hospital.
So, George, you had to move your time here with us today up by an hour because you were attending a funeral of one of your colleagues. Is that right?
Today was the funeral of a New York City paramedic. As far as I know, the first paramedic who has died as complications from COVID. He's been working for decades in New York City, and I also knew him as an educator. So he had worked pretty much all over New York City, very well-known, well-respected, Anthony Thomas. And so, today was the service, which was, even drove the point home of, we couldn't really do a service like we would have normally done a service. We attended in our vehicles, lined up when they brought him out from the funeral home. And then, the line of ambulances and other vehicles. But obviously you can sense the difference from how it would have been had it been non-pandemic times. So that really drives it home. It could have been any one of us. We don't know exactly how he got infected. But there are a lot of other EMTs who have died as well in New York City. There's quite a number of EMTs and paramedics that are hospitalized, a few of them intubated, close friends of mine as well. And there's a lot of people who are also at home, because they've been infected and they're quarantining, isolating at home. So it certainly drives the point home about higher risk that we're taking by working in this field. But, like Dr. Naturale said, no one said, I'm not going to work. They continue to show up for work, and obviously under very stressful conditions and anxiety-producing circumstances. So, but we continue to do what we enjoy doing and what we want to do.
Yeah, and this is, I guess, a question for Dr. Naturale. So in terms of educating healthcare workers, on how they can, how does one process this or take care of themselves or know what to expect and then hopefully get the help that, they may need at some point? It's just so layered. And
it is layered. That's a good description of it, Maureen. But the good news is that human beings are actually really pretty good at managing different types of distress and serious events. And otherwise, we would never have survived as a species. So we know that we have some real good tools that we can use, as we talked about earlier, is making sure that we're talking to others and having those social connections. Even though we can't do it physically, we can continue to get support and help from others and try and stay into some routines. But I think one of the things George noted, it was really good to hear that all the staff were able to go by in their cars as a type of funeral. Rituals are really important to us. They help us to honor and remember those who have died, and we need to be able to do that. We are creatures of habit and ritual. So I think what's going to happen is that people will start developing new rituals that can be acted upon even in these tough times. And we highly, highly encourage that, whether it's to do the cars and the drive-bys that have been going on, or put together Zoom meetings so that you can all be together at least on the computer and turn the cameras on so you can see each other and get whatever cues might help you to be more socially connected. And so I think there's going to be a lot of different changes in how we ritualize and memorialize when we have these losses. And hopefully that'll be a good thing to bring us some comfort because it is important for us. We're going to remember these people for the rest of our lives. I don't think there's really such a thing as closure. I think it sounds like a good idea, but I don't know anybody who said that they forgot all about somebody that they loved in their life who died. So remembering and memorializing and honoring that memory is going to be an important thing for us to do, however we do it, whatever ritual we decide to do it by.
And then, George, I'd ask you, like, what do you do to, I don't know, when you are done at the end of the day, and you go home and try to go to bed, how are you processing this?
I've been working this for a long time. Never had 5, 6, 7 people die in one 12-hour shift. It happened on day in, day out. So that's pretty, because each death, you realize, or at least I do, stop for a moment and says, this person died, and the impact that has on the family members and their immediate social circle. It's just huge. And when you see the numbers, when I saw the numbers at the end of the day, how many people died the day before, it just magnifies the severity of what was going on in terms of this current pandemic. What I found, and everybody's different, obviously, but what I found to be very helpful to me was to be on my way into work. I drive down the West Side Highway, and I pull over and I kind of take a few minutes and kind of just enjoy the water and kind of do a little quick meditation before going to work, and do some people watching as people are going by, running, jogging, or riding the bicycle. And just kind of, for me, I've always liked the water, and it's very calming for me. So I look at that and stay there for a few minutes and then go into work. And then after work, I kind of do the same thing. Mm-hmm. I take a moment afterwards, because you need some way to kind of debrief myself of what has happened during the shift. And that certainly helps me. And also, overall, from a physiological perspective, it helps me slow down my metabolism, because you're kind of on an uptake while you're working in those circumstances. But that's what's been very helpful for me.
Yeah, and Dr. Naturale, would you add to anything?
Yeah, I'm so glad to hear, George, that you have some ritual for yourself. And I think that that's wonderful and smart, obviously, while you're still able to do this work. And your idea, too, about recognizing each person, not just as somebody who died. And I think that's something that can absolutely help us to process what's going on. You ask the family, or you try and find out, what was the story? Tell us something about them, so we can put that human face to it and honor that and remember that. And it certainly can bring comfort to the families to say that you were there and you talked to them, and tell me a story about them, and be able to give them some sense of dignity and honor that somebody was there with them and somebody talked to them and remembered them in that moment. It's pretty impressive that you've been able to do that. I'm sure that many families have been comforted by the fact that you were there.
Family members, they have people who have died, and let them say their final goodbyes. They've come up to me and say, even during their pain and grief and sorrow, they've come up to me and say, thank you for giving me the extra time. Because under these circumstances, a lot of times, like I said, the times are different. People, sometimes I've told them, I said, I think you should, is there anything you want to say to them? Because you may not be able to see them for a while. And so they've said their goodbyes, because visitors and families weren't allowed to go with them to the hospital. So I told them, you may want to say something as they say goodbye, and they have. And for some people, I know for a fact that was the last time they saw them alive.
It's an incredible gift you gave them, that opportunity to do so, George.
Yeah, and I just want to say, George, the work that you're doing is heroic. I've heard, the healthcare workers don't want to be referred to as heroes, but I don't think there's any way to get around that. So,
I don't like it either. Thank you for that, but just doing our job as long as I can still do it.
Well, I want to thank you both for being here today. And if people would like more information, you can go to everydayhealth.com. And thank you again. For more great tips on navigating your health and well-being during the COVID-19 pandemic, go to everydayhealth.com/tips. Tippy.